Hi, I'm Maddie.
Hi, I'm Victoria.
I'm Ashton.
Hi, I'm Jackie.
Hi, I'm Annalise.
Hi, my name is Alicia.
Hi, I'm Gemma.
And we are
The Joan and Stanford Alexander Fellows 4.0.
The word I would use to describe the fellowship that would, I guess, inspire other kids to do this fellowship would definitely be inspirational. This is an amazing fellowship. It really takes you out of your comfort zone. It allows you to be uplifted by the stories that you hear, the families that you meet, the patients that you get to interact with. It's definitely an inspirational experience.
And then I think from a professional standpoint, it was really insightful to the different types of patients you might encounter and what their lives look like. It's not something that we often get exposure to. So I think that was one of the most beneficial parts of the fellowship.
Yeah. I would say that it's very fulfilling too, like what Jackie said, you get a little sneak peek into this population's world, and it's just so great to see how they interact and how they think, and they've just been wonderful to work with.
I was very humbled by this experience for sure.
I would say it's all-encompassing. When we think of disabilities, we usually think of like Down syndrome or on the autism spectrum. But when we went to the fellowship, it was more those who got amputations or genetic anomalies. And I think that was a perspective that we all needed to see.
Yeah. To go off that, it was just a unique experience overall. I just was like really amazed and like humbled to see just how much like people can do in this population, and it's just really inspiring.
I think the most valuable skill that I obtained in this fellowship is compassionate communication. So the communication skills you need, it translates across patient spheres. So I think learning that by being put into different situations that were challenging, that pushed me out of my comfort zone, is the most transferable skill that I took away from the fellowship.
Yeah, exactly.
Yeah.
And you can go first. No.
Like on top of compassionate communication, it's also empathetic communication because we have no idea exactly what they're feeling and what they go through and the disparities that they face in the healthcare system. So we have to do our best to debunk those myths and work better to fit their population and their skills that they have.
Something I want to add is we also communicated with a lot of other interdisciplinaries. So with OT, we got to see what they did and how amazing they are. PT, and how instrumental they are as a team of building up a patient. And so I thought that was very great.
Yeah, absolutely.
And going off of that, just team dynamics at different locations as well, like how different, going to transition and going to tier OT and different places like that. Just seeing how different hospitals and things like that work is really also eye-opening and teaches you a lot getting into the field.
So one thing that has changed my mind about disabilities, I think would have to be what happened to me yesterday actually when I was at Arbor School. I was with the older kids, 10 to 12-ish age group, and a lot of them are nonverbal. And so just seeing how they communicate, it's like that they can understand. And so for me that was a big thing because I haven't ever been around anybody that was nonverbal. And so one of the children, they were playing basketball and he was the only verbal one in the class, and you could tell that the other boy wanted to play but he couldn't talk, and so he went to his communication device and put "my turn please." Aww. And it was nobody prompted him to do that, but he wanted to play. And so for me it was just kind of wow, we assume that just because they can't talk, they don't know what we're saying, they don't understand, they can't communicate, but they do. And it was so amazing to me that's their life, that's their lifeline. So that was just really cool, and it took till the last rotation to see something like that, but I thought that was really neat.
Yeah. And similarly to you, I had a great experience at the Rise School. I got to play with the little babies, and something that I got some insight into is that these babies, even though they were young, just because they had disabilities, I noticed that a bias I had is that I thought they would be extra fragile and that I can't handle them a certain way, but they are so much more resilient and they're just so amazing. And even just interacting with them, you can see that they're capable of so much more than they get the credit to. And I think the Rice School is also just amazing for trying to set these kids up from such a young age to integrate them. And on top of that, their classrooms are integrated with typical children and disabled children, and watching their dynamic was just amazing.
Similar experience with another nonverbal client at transition. It was a Hispanic client, so I'm one of the only people on this crew that speaks Spanish. So, I mean, it's a little different experience because I was able to translate the whole interaction, which I feel like made the mom a lot more comfortable, made the daughter a lot more comfortable. And I was able to administer the flu shot to the patient, and, you know, I mean, she was just smiling and as happy as could be, and gave us hugs afterwards. Big hugs. And then, you know, we saw them later on, like in the elevator, and they were just hugging and loving on us. So it was just very like heartwarming to see that, and to see that we could have an impact on our patients and their families.
Yeah, it has definitely prepared us in many ways, this fellowship. Aside from just working with a disabled population, we got exposed to so many skills that we weren't able to be so hands-on with our first semester. And then on top of that, working with a disabled population, you have to learn how to be patient and communicate with them, because sometimes they don't communicate the same ways that we do. And I felt like in more ways than one, like this fellowship has prepared me more than anything else for my future.
Yeah, absolutely.
I think also one way that it has prepared me to be a more well-rounded nurse is actually just seeing so many different places and so many different resources that are available to people. So most of, I guess all of the rotation sites that we went to, I'd never heard of, had no experience with. So understanding what's available to your patients is super important, because your job as a nurse is to be their advocate. So having some kind of, I guess, knowledge base to work from, I think was one of the most beneficial parts of this fellowship. And just realizing that there's, you know, even if you have a patient that maybe you don't know what's available, but understanding that you can seek out resources, because there is so much available to people.
I would say this fellowship has for sure changed my heart and my mind towards medicine. Makes me tear up thinking about it, but seriously, it's awesome. And like, people in this profession are so special. I've learned so much, just like compassion, empathy. I'm so humbled by getting to work with this population and like be impacted in the way that I was. Now I feel like I have found my purpose in medicine, and I hope that like one day I can do that.
You're gonna make me too.
Oh my God! Don't do it.
But seriously, this has changed my my view on medicine, and I'm so thankful for this experience.
I just want to say that Dr. Edwards is an amazing professor,
Yes.
and that she truly just wants you to learn. Like something that sold me to the fellowship was the first day in orientation. She was like, I don't want you to be stressed, because then you won't learn. And I was like, thank you. Like,
And we've learned so much.
right? And she supports you through the entire journey and always checks up on you through
She
skills,
does.
through interactions, and everything. So
Yeah, she
we're
kind
very
of spoiled me too, because at the beginning of the clinical, she would come and see us all the time, and he would either eat lunch with us or just come hang out with us. And then one clinical day, she didn't come, so I'm texting like, where are you? She's like, I can't come today. I'm like, oh man. So you need to be in this fellowship, because it's going to be so amazing when you're out in the workforce and you're like, oh yeah, I did this fellowship with Dr. Oh, I know Dr. Everybody knows Dr. Edwards. So you need to be in this fellowship. It's absolutely doable. There's not a lot of coursework, but the work that is provided is meaningful. It'll make you really appreciate the work that we're doing, and it also reminds you why you became a nurse. It reminds you, it brings you back to the core. So you kind of get lost with all of the work that's on you, like, oh, I got to test, I have to study. But being in this fellowship reminds you that it's all worth it. It's all worth it in the end if you get to make an impact on someone's lives, you know, in a meaningful way. So
It's definitely the breather,
Right.
like of my week. It's like,
absolutely.
I got to go to my fellowship.
Yeah.
And there's no type of experience like this.
Yeah.
You don't get that education like this, even just by being there. I mean, you know, we didn't have the in-depth understanding of autism and Down syndrome and all these other genetic conditions, and just, it's amazing.
It's like something I'm thinking someone says, and I'm like,
But I have a piece of advice for future fellows.
Okay.
Which is, this experience is a lot what you make of it. So when you're at these facilities, don't be afraid to dive in, because that's what you're there to do. So, of course be respectful, but get in that room with the physician if they'll let you. Watch what they do, learn from these people who do this for a living. You learn so much. So don't be afraid when you're actually there.
Don't be shy.
yeah,
That's
don't be
right.
Yep.
That's right.